Welcome to the AI Research Roundup. I'm Alex. Today we're looking at a paper trending on X, published on August 3rd, 2025, about 4 days ago. This work introduces a new set of open-source models that achieve state-of-the-art performance on 10 out of 12 biomedical benchmarks, with a massive 9.72 percentage point gain on one particularly challenging dataset. The paper is titled OpenMed NER, Open Source Domain-Adapted State-of-the-Art Transformers for Biomedical NER across 12 public datasets. And as we'll see, their approach is not only powerful, but also incredibly efficient. The key idea is combining domain-adaptive pre-training, which makes a general model an expert in a specific field like medicine, with an efficient method called low-rank adaptation, which allows them to fine-tune these huge models by only updating a tiny fraction of their parameters. And it's clear this mission of creating open, efficient models is a personal one for the authors. On X, one of the authors shared the work, stating that it validates the models he released a few weeks prior. He frames it as part of a larger mission to prove that efficient, open-source models can outperform expensive, closed-source healthcare AI. He even includes a graphic with the title, One Mission, Open Healthcare AI for Everyone. Alright, so this table breaks down just how they achieve that efficiency during the domain-adaptive pre-training stage. They start with a carefully curated corpus, mixing about 350,000 passages from research papers and clinical notes to make the model an expert in medical language. But the real magic is in the adapter. Using low-rank adaptation, they only update less than 1.5% of the model's parameters. And perhaps the most impressive detail is the hardware. This entire stage runs on a single NVIDIA A100 GPU, which is truly remarkable. This table then details the specific transformer backbones they used, essentially the large, pre-existing models that form the foundation. They chose 3 powerful ones already familiar with scientific text: DaBERT v3, PubMedBERT, and BioElectra. What's crucial here is the ratio of frozen to trainable parameters. For each model, over 300 million parameters are left untouched, while only about 4 to 5 million, or 1.4%, are actually trained. This is that incredible efficiency in action, achieved by inserting these small, trainable adapters right into the model's attention mechanism. Okay, so after preparing these highly efficient models, the next logical step is to put them to the test. This table lays out the 12 different benchmark datasets used for the evaluation. And what's really striking is the diversity here. The models aren't just identifying 1 or 2 things. They're tested on a wide range of entity types, from chemicals and diseases to genes, proteins, and even very specific cell lines. The data sources also vary, covering both scientific literature and clinical notes, which really puts the model's adaptability to the proof. And this table brings it all home, directly comparing OpenMed NER against the previous state-of-the-art, including closed-source models. The results are just fantastic. On 10 of the 12 benchmarks, their open-source model sets a new record. We see some really substantial gains here. For instance, on the BC5 CDR disease dataset, it improves the score by over 2.7 percentage points. And on the challenging CLL dataset, the improvement is a massive 9.7 points. So to wrap things up, this work on OpenMed NER really drives home a powerful message. It shows that strategic, efficient adaptation is often more critical than sheer model scale, especially in specialized fields like medicine. These open-source models not only set new records, but are also secure and accessible for sensitive data. That's it for this episode of the AI